Imagine eating the exact same dinner, with the exact same calories, but moving it 3 or 4 hours earlier. Could the clock alone change what happens to your blood sugar overnight? Two controlled crossover trials say it can, at least acutely. A newer, very small trial found no significant difference. That tension is useful. It shows why the honest answer is not that late dinner is poison, or that timing never matters. It is that your metabolic response depends on both the clock and the person. The first trial studied 12 healthy adults in a randomized crossover design. Each person followed an early dinner condition at 6 in the evening and a late dinner condition at 9. Because the participants experienced both schedules, they served as their own controls. The meals had the same energy content. Continuous glucose sensors tracked the full day, and researchers also measured fuel use after breakfast the next morning. This design isolates meal timing far better than simply comparing naturally early and late eaters. The glucose trace showed the key difference after dinner and overnight. Average nighttime glucose was lower in the early dinner condition, and the 24-hour average also differed significantly. The meal itself was not healthier. It arrived earlier. That fits a basic circadian idea. Glucose tolerance and insulin sensitivity are not constant across the day, but the study was short and small. It demonstrates an acute physiological response under controlled conditions, not that moving dinner guarantees weight loss or prevents diabetes. The next morning brought another signal. After the early dinner, the respiratory quotient after breakfast was lower at selected time points. In plain English, the body appeared to rely relatively more on fat and less on carbohydrate for fuel. That is interesting, but it is easy to overstate. Respiratory quotient is an indirect snapshot of substrate use. It is not the same as losing body fat. The trial did not show that eating at 6 automatically changes body weight over months. A second crossover trial pushed dinner later, 6 in the evening versus 10 at night, with sleep fixed from 11 to 7. 20 healthy volunteers ate isocaloric meals during both laboratory visits. After the late dinner, the post-dinner glucose peak was 18% higher. Average glucose across the 20-hour measurement period was also higher. The late meal shifted the post-meal response into sleep, when circadian biology and lower activity may change how glucose and fat are handled. The same trial found lower dietary fat oxidation after the late dinner and higher plasma cortisol, particularly in people who usually slept earlier, but measured sleep architecture did not change. This distinction matters. A metabolic effect can occur without an obvious change in sleep stages on one night. It also warns against a causal pileup. The study did not show that cortisol caused the glucose result, or that one late dinner causes obesity. It measured short-term physiology in a young, lean sample under controlled conditions. Then comes the result that keeps the story honest. A 2025 randomized crossover trial reported no significant differences between early and late dinner conditions across its continuous glucose monitor measures. Mean glucose, variability, and time in range did not significantly change. The sample, however, was only 8 adults. That makes the study useful as a warning against certainty, but not strong evidence that timing has no effect. A tiny null study can miss a modest real difference just as a tiny positive study can exaggerate one. Put the 3 trials together and a responsible pattern emerges. Under highly controlled conditions, moving dinner from late evening to earlier hours can lower acute nighttime glucose in some healthy adults. The effect may be larger for people whose late meal overlaps their biological night, but we do not yet have enough large, long trials to promise a long-term health outcome. Meal quality, total energy, medication, work schedule, and individual chronotype can matter more than a universal dinner deadline. A practical test is low-tech. If dinner often lands near bedtime, try moving it earlier by 1 to 3 hours on days when your schedule allows. Keep the meal itself roughly similar so you are testing timing, not a new diet. Notice sleep comfort, reflux, hunger, and morning energy. If you use insulin or glucose-lowering medication, do not change meal timing without clinical guidance because the timing of food and medication can interact. The evidence supports an experiment, not a rigid rule. The takeaway: calories are not metabolically identical at every hour, and two crossover trials found worse overnight glucose after late dinner. But the studies were small, short, and not unanimous. Eating earlier is a reasonable option if it fits your life, especially when dinner otherwise falls close to sleep. Treat it as one lever among many, not permission to ignore food quality, and not a moral judgment about shift workers or family schedules. The best evidence says timing can matter. It does not say timing is all that matters.